All right. So now that we've gone over what the process looks like overall and evidence-based medicine, let's get into the first, not technically part of the nutrition care process, but what's going to lead to the nutrition care process, and that's screening. So screening is not formally a part of the NCP because lots of medical professionals will do the screening. The nutrition care process is only for RDNs. So, screening is used to identify patients or clients at nutritional risk. And of course, this needs to be population specific. The nutritional risk needs in a child are going to look a lot different than an adult. And often, people will need to be re-screened. Even in the case of in an emergency situation or an ICU, the nutrition needs of a patient may change hour to hour or day by day. So there's several tools that we can use. The malnutrition screening tool, the mini nutrition assessment short form, or the nutrition risk screening. And as you're doing your case study for the anthropometrics, you'll read a little bit more about these screening tools. So now let's get into the actual nutrition care process. And we're going to start with a dime. There's 4 steps to a dime, and you probably guessed they make up the word a dime. So we have nutrition assessment, diagnosis, which includes the problem, the etiology or what's causing it, and signs and symptoms. And this is also going to make up probably the most important thing you'll learn to do in this class, which is or are PES statements. There's also intervention. So it's not enough just to assess and diagnose, we need to try to treat. And then once we decide on an intervention, we need to monitor and evaluate. So let's start with assessment. The purpose of an assessment is to obtain information needed to identify a nutrition related problem. And since, as you guessed, this class is called Therapeutic Nutrition 1 Assessment, we're mostly going to focus on this, but I am going to give you a quick overview of the whole process. So during the assessment, you're going to review data for factors that affect nutritional health and health status. And the type of data you'll collect will depend on your setting, but it may include diet history, medical history, anthropometrics, various labs. So, usually when we refer to labs, that means some sort of blood draw, cognitive function, etc. There's lots of things we could collect that are going to go into our assessment. We then have to take all of this data and cluster it in order to identify our nutrition diagnosis. So it's not enough to just have biochemical values. For example, say we have biochemical values that indicate the person has some form of megaloblastic anemia. We're going to need more information to determine if it's from a B12 deficiency or from a folate deficiency, or potentially something non-nutrition related. And to do that, we also are going to need to identify standards to which our data will be compared. So this might be the DRIs. These might be standards for blood sugar from the American Diabetes Association or from the American Society for Enteral Nutrition, or it could be institutional standards at your hospital or work setting. And we also need to use specific and standardized language. And this is where the ENCPT comes in. And hopefully you have all purchased your subscriptions to this. You will need it for all of your case studies and lab work. We need to use specific terminology so that when we are describing something, it's intelligible to both other dietitians as well as other members of the healthcare team. So the terminology for dietitians is divided into 9 domains: food, nutrition related history, anthropometric measurements, biochemical data, medical tests and procedures, physical exam, and client history. And as you can see, these are all highlighted blue. These are all the ones that are related to assessment. But we also have assessment monitoring and evaluation tools. We have the etiology categories, comparative standards, and progress evaluation. So we have terminology for the entire nutrition care process. From this, we have the ongoing dynamic process that involves initial data collection as well as a continual reassessment and analysis of the client's status compared to our comparative standards. So it's not enough to just assess and diagnose. We need to intervene and we need to keep assessing as we're monitoring to make sure that our intervention is actually doing what we want. Nutrition assessment initiates this data collection process. And that is continued throughout the nutrition care process and forms the foundation for the nutrition reassessment and reanalysis so that we can continue to monitor and evaluate our clients' progress. And the biggest thing that you'll need for this is critical thinking. You need to determine what is important and relevant data to collect. If you suspect that someone has an anemia, you need to know which labs to order. You also need to look at the trends of the labs versus just a single value. You also need to determine when you need more information. So the US Institute of Medicine advises combining intake data with clinical, biochemical, and other supporting information to complete a valid assessment of nutritional status. Selecting your assessment tools and procedures are important, and they need to match the situation. If you're working with community leaders to support community gardens and locally grown food, knee height measurements to estimate height might not be the most useful. But if you are measuring height in someone who is bedridden, a knee height measurement is probably more useful. You also need to apply assessment tools in valid and reliable ways. So you can't just use any tool. You need to make sure that it has been validated in the population you're looking at. And then you need to validate your data. So there may be variability in laboratory data depending on the lab performing the test.